Everyday knee pain come to us into OPD, especially the young patients in early 40s, early 50s. We tell them that knee replacement is the only answer, but the life of the knee replacement is about 15 to 20 years. So we carry on somehow, get it done as late as possible, so that you don't need more than one surgery in your lifetime. We all know that the knee actually has got three compartments. It's got a compartment for the medial compartment, which is the inside of the knee, a lateral compartment, which is the outside of the knee, and a patellofemoral compartment, which is the part of the knee which is behind the kneecap. When we do a knee replacement, we actually replace at least two of the three. So that means we cut the lower part of the thigh bone, we cut the upper part of the leg bone, and we replace it with metal. And we put a plastic in between. And we have to sacrifice at least one, if not two, the two major stabilizing ligaments of the knee. So knee replacement will always have an artificial effect. It will never give a natural feel because most of the part of the knee is replaced. Now, what we can do is actually replace individually the three components or the three compartments of the knee. The major indication for that is the patient should have only that part of the knee replaced. The major benefit being that we are leaving the normal bone intact, the ligaments intact, so the patient has a normal bleed after the surgery. The life of the partial knee replacement or the half knee replacement is about 12 to 15 years. When it can be easily changed to a total knee replacement, which can last another 15 to 20 years. So by giving a partial knee replacement, we are actually giving the patient almost 35 years of pain-free life with prostheses which have been proven to give reasonably good functions and are durable. So if we can do a partial knee replacement say at the age of 50, so basically by revising it to a total knee replacement later wherever needed, we can actually do away two surgeries in a patient. This total knee replacement that later sees it through. Otherwise, world over is being done. At 50, we tell the patient, oh, you are too young for a knee replacement. Somehow bear the pain, stay with it, come back to us at 60 or 65, we'll do a knee replacement. So in productive years, years when we should be active, is actually staying with pain. Other advantage being that the advent or with the advent of the orthopedic robot, these replacements can be done robotically. That means we do a CT scan of the patient, we predetermine the implant size, the implant position, and the implant alignment. And we can place the implant absolutely to the base with the correct ligament balance, which ensures that the patient has a virtually pain-free normal function post-surgery. These half-knee replacements can also be done robotically, ensuring an absolute correct placement. These patients who have, say, knee pain or need a replacement, there are three more things which come to everyone's mind. Who are the correct patients? Are young patients who have only one compartment involved, that means only one part of the knee is affected. It can be post-traumatic arthritis limited to one compartment, but we should not do it in conditions where the whole knee is likely to be involved, like inflammatory arthritis, rheumatoid arthritis, or arthritis which is secondary to any kind of a septic process and infective arthritis. After we have decided that the patient needs a surgery, we have to decide what kind of a prosthesis. Because we also have choice of prosthesis for half knee replacement. Titanium, niobium, alloy. The partial knee replacement also can be a fixed bearing where the plastic is fixed to the metal, or it can be a mobile bearing. So that will all decide, depend on mainly the patient age and also on the surgeon preference. Because both mobile and fixed bearing have virtually got good results and long-term durability reports. Then we have to decide whether we do a robotic or non-robotic. Can be done non-robotic. Robotic only ensures that each time we do it, we put it in the proper alignment, we use the correct size, and we put it precisely in the same location. So I would now kind of request everyone, if you have any questions about the partial knee, you are free to ask. And I am sure that I would be able to answer all your questions regarding knee arthritis and partial knee replacement. The expenditure का देखा है, so implant cost का क्या थोड़ा difference नहीं for the price of knee replacement cost का almost same ही है.
Almost same.
Implant cost is the same, but major advantage partial knee के same knee कि मैं next day discharge करा लें. ये शोमल वाला operation है तो weekend वाला कि मैं next day patient के discharge करा लें. There's knee replacement है तो 4 दिन का. So hospitalization cost का कुछ है. Hospital cost of 4 nights or 4 days will be less. So it's an advantage will achieve. With the recovery, very less complications, less hospitalization, full movements, and actually outweighs and then no limitation factor. That outweighs the cost.
এটা কতটা সফল হয়েছে আপনার মনে হচ্ছে এটা পার্সোনাল যে আপনি যে পার্সিয়াল রিপ্লেস করছেন কতটা সফল বলে আপনার মনে হয়?
আমি রিপ্লেসমেন্ট পার্সিয়াল রিপ্লেসমেন্ট করছি 2005 থেকে প্রায় 2 বছর হয়ে গেছে। I have also been the surgeon who was my mentor has been a designer for a partial knee. My experience has been really good in the sense that I've seen young athletics being able to go back to their normal activities almost to the pre-surgery level.